The next, please. So the basic aspect of this political definition was and is linked to this people or human rights-centered health system in opposition to a market-oriented health system. But it doesn't mean that in the moment that we establish this people rights-oriented system, we eliminate the market. No, the market is there. And one of the main missions of a public health system is to control the markets. We know that the market existed before the capitalism. So we need to control the market in the sense to avoid that health become a commodity. Okay? That's very important. But we need to be aware, to be conscious that our main task in order to build this people human rights centered health system is to control the market. And as we will see later, is to control the private sector and to put private sector within the frame of a public system. That is this is our historical experience, no? Because of course in Brazil, we didn't do a socialist revolution. We have a capitalist society, but within the frame of this capitalist society, we are building a socialistic approach to health. Yes, if I can say like this. No? That's very important to understand. And it explains a lot of our contradictions and at the same time, most of our advancements. Next, please. So maybe one thing that's quite important to understand is that when we talk about people, human rights-oriented health system, we are talking about, in order to be coherent with this human rights approach, we are talking about to be universal. And to be universal means that everybody is included. Everybody is included. That's very important to understand. Because in the hegemonic language, in the hegemonic speech, we are talking about universal coverage now. Huh? Everybody is talking about universal coverage. But in a different sense, in a sense that we will cover everybody with different benefits. We have a package for the poorest, we have a package for the more or less poor, then we have a package for people that can pay something, and then the package for people that can pay everything. Okay. But this differential of benefits that will be represented by this comprehensiveness dimension of the universal system is something that cannot be separated from the universalistic approach. I mean, if everybody in this room is included in this system, everybody in this room will have the answer that everyone will need according to the health problem they have or the health need they have. That's really very important to understand. And in Brazil, we were very coherent about that in the sense that our constitution established this principle of comprehensiveness. And it permitted to us to have today a system, despite all the problems that we have a system where there is no discrimination in terms of the nature of the benefit, the nature of the care. No? Everybody is included, for instance, for transplantation. Everybody is included for very expensive drug therapy. Everybody is included for intensive care therapy, whatever. So it means that we assumed the pressure that comes from society since we adopt a concept of universal and comprehensive. So we are not talking about only primary health care facilities. We are talking about the whole complexity of health care. And this is very important to understand. Because I cannot accept that in many countries around the world, we are talking about universal access, but depending on the capacity to contribute. So you have oncology therapy, well, for people that can afford full treatment or partial treatment, and the others that cannot afford will do diagnostics, but with no therapy. We have countries where we can do cervix, no? Uterine cervix screening, but if you have cancer, they won't provide treatment. How is it acceptable? It's not acceptable. So the principle of comprehensiveness established that we need to put everybody in our equation, but everybody will be covered in the corresponding dimension of their needs. That's very important to build in our mind the dimension and complexity of the health system. Huh? And the third dimension is equity. I mean, when we adopt this universal approach, we need to be very conscious that there are some people that already have a good status of health, already have some good access to health care, but others don't. And this gap must be continuously attacked by the public policy on health, because we need to reduce the gaps of mortality, the gaps of disease incidence, no? The gaps of healthcare access, the gaps of quality of care, because if we adopt this completely human right-oriented process, we need to be very conscious that what you provide for society cannot discriminate among those that have money and those that don't have money. That's very clear. No? In this sense, the free access is fundamental. And the other aspect is to disconnect the standard of healthcare to any kind of contributive process.